Wounds, in particular chronic wounds, present a challenge to patients and healthcare providers and also represent a major healthcare burden worldwide. And the burden is growing rapidly due to increasing healthcare costs, an aging population, and a sharp rise in the incidence of diabetes and vascular disease worldwide. To combat the increasing number of patients with chronic wounds and wound healing problems, the need for advanced wound care technique is sharply on the rise. Pulsar 2 AWI, CE marked, is an advanced wound irrigation system, debriding many kinds of chronic non-healing wound bed of devitalized tissue without disrupting the underlying normal tissues. Pulsar 2 AWI composes a pulsar irrigator and a totally contained wound irrigation bag. The irrigator delivers positive pressure through pulsation of irrigation fluid. Irrigation bag provides isolation of the wound. When a pulse of water strikes a tissue, the force of the pulse causes a brief compression on that tissue. Between pulses, target tissues decompress or recoil. Pulsar 2 AWI produces multiple rapid iterations of tissue compression-decompression cycles that mechanically dislodge bacteria, non-viable tissue, and debris from the wound bed. Adherent non-viable tissue remaining after a Pulsar 2 AWI treatment is hydrated and loosened, thereby assisting natural phagocytosis. Compression-decompression mechanical manipulation also assists in exudate removal. Finally, Pulsar 2 AWI appears to improve growth of granulation tissue and then heals the wound. Pulsar 2 AWI, delivering innovative solutions for wound care. It can be effectively used in chronic wounds debriding, like traumatic infection wounds, pressure ulcer, vascular ulcer, diabetic foot ulcer, scald wounds, cancer wounds, etc. Pulsar 2 AWI wound therapy does achieve effective debriding. One debridement with 3 minutes can remove 86.9% of bacteria without frequent surgical debridement, and patients are free from surgical pain. More frequent debridement has been shown to enhance healing for chronic non-healing wounds across a variety of patients. Innovation and safety. Using 8 to 15 pounds per square inch of pressure provides selective hydromechanical debridement and removal of bacteria, necrotic tissue, and biofilm with each treatment without disrupting the underlying normal tissues. Convenient and better tolerated by patients. Portable equipment, no special environmental restrictions, wound cleaning at any time and anywhere, such as in an emergency or accident, nursing home, clinics, patient's home, and also at bedside. Infection control. Irrigation bag provide closed environment to prevent splashing, eliminate cross-infection, and lower the risk of cross-infection. The solidifier totally absorbs 5 liters of saline and converts it into a gel, encapsulating the bioburden from the wound bed and neutralizing it, so making it safe for disposal in regular waste. In 2005, an outbreak of multi-drug-resistant Acinetobacter Bowman, traced back to open suction assisted pulse lavage treatments, infected multiple patients, several of whom died from their infections. In 2008, a research proved that wound irrigation bag is a useful new tool that protects the debridement facility by significantly reducing the dissemination of infectious particles. So AWI bag allows for safe delivery of pulse irrigation without risk of infection, colonization, or contamination of the treatment field, patient, healthcare provider, or facility. Pulsar 2 AWI wound therapy system composes irrigator, standard tip, tunnel tip, extremity bag, and trunk bag. Before debriding, please choose the suitable components according to the location of the wound bed. For wounds located on the trunk, choose the irrigation bag for trunk. Open its package, take out a standard tip and a trunk bag with granular. Cut the opening into suitable size according to the size of the wound. Then apply the bag to the treatment area, ensuring that it is fully sealed. Take out the irrigator and standard tip, attach the tip, insert the spike of the tube to the saline bag, and then start to debride. After the treatment, carefully remove the irrigation bag. Finally, the contaminant slain was absorbed by the granular. If there is a tunnel, change the standard tip into the tunnel tip, and then debride the tunnel wound. For wounds located on the extremity, choose the irrigation bag for extremity. Sleeve the bag onto patient's leg or arm to cover the treatment area, and then start to debride. Pulsar 2 AWI offers an innovative and safe pulse irrigation system to provide selective hydromechanical debridement to chronic non-healing wounds. It is one such innovation that is worth consideration and which is suitable for a variety of wounds. Case 1. In Case 1, it was a post-operative infection wound with diabetes prior to treatment with Pulsar 2 AWI. Patient had received treatment for 5 months, and there was no improvement in the wound bed. After about 2 months, the wound healed by 3 pieces Pulsar 2 AWI. Case 2. This case was very shocking. Diabetes, post-operative infection after amputation, very serious infection, so that his doctor told him to give up. Fortunately, the doctor gave 2 pieces Pulsar 2 AWI to the patient for free, and told him how to use them and also how to formulate normal saline at home. After 2 months, the patient returned to the hospital to tell his doctor his wound was healed. This picture was the amputation healed wound. Case 3. This woman encountered a car accident. Her leg was infected and non-healing for 33 days, facing a risk of amputation. The doctor tried Pulsar 2 AWI. After 3 times of lavage, new granulation tissue growing. These B-fried tissue was the new granulation tissue. Case 4. Female, 70 years old, hepatic carcinomas, acute medicational ulcer. It was very difficult to clean this kind of ulcer because of the hair with tweezers, surgical blade, or any other irrigation facilities. With AWI, it was very easy to control the ulcer. Pulsar 2 AWI uses low-pressure irrigation 8 to 15 pounds per square inch, generally tolerated with minimal pain or discomfort, using a no-touch, no-suction technique to remove necrotic tissue, reduce bacterial bioburden, and then enhance chronic wound healing.